Hello, and welcome to GAPNA Chat, an official podcast of the Gerontological Advanced Practice Nurses Association. GAPNA Chat provides interviews and discussions with GAPNA leaders and members of the gerontological healthcare community, and will focus on advocacy, policy, education, professional development, research, and clinical care for older adults. Before we get started, a practical guide for the gerontological specialist is now available for purchase in the GAPNA store. This text is a handy resource for anyone caring for older adults and is helpful to those preparing to sit for the Gerontological Specialist Certified exam. Visit www.gapna.org to get your copy. In this episode, Dr. Cassandra Von Ness, a gerontological nurse practitioner and member of the GAPNA communication team, talks with Dr. Sue Mullaney, a healthcare consultant, gerontological nurse practitioner, and gerontological specialist for SeniorCare Executive Services in Needham Heights, Massachusetts. We are pleased to present Dr. Von Ness's interview with Dr. Mullaney.
Hello. This is Dr. Cassandra Von Ness, welcoming you all to our GAPNA Chats. And today we have with us Dr. Sue Mullaney, who is going to talk to us about political advocacy. Dr. Mullaney has worked in the care of older adults for over 30 years, working as an NP in primary care, home care, long-term care, before transitioning to her leadership roles. She is a fellow of the Academy of Nursing and the fellow of AANP. During her 24 years at United Health Group, Dr. Mullaney focused on leading NP teams, clinical model development, clinician growth, academic practice, partnerships, and health policy. She partnered with internal business colleagues and external organizations to promote the role of NPs. Dr. Mullaney received her Doctor of Nursing Practice and Master of Nursing from the University of Massachusetts, Lowell, and her BSN from Boston College. She serves on national task forces and is active within her professional organizations, including being a member on GAPNA's Health Policy Committee. Hello, Dr. Mullaney, and thank you for joining us today.
Hello, thank you for having me.
So, reading a little bit about you, I found that no one in your family was in healthcare when you decided to become a nurse. Anything you could share with the 18-year-old Susan about her nursing future?
Sure. Yeah, that's right. Nobody has a clue where that came from, and I don't know where it came from, but I decided when I was 5, I was going to be a nurse, and X number of decades later, I have never changed my mind, and here I am. What would I tell my 18-year-old self? Really, it's about, in my mind, taking advantage of every opportunity to learn and grow, because you never know what's around the corner. At 18, I had a vision of what my nursing career was going to be, didn't know much about what was out there, but had lots of great mentors, lots of opportunities, and just did things I never thought I would be doing. So it's fun.
It's interesting to look back, isn't it? And what we had thought the road was in front of us, and then the turns and bumps and sidetracks we get. So that's always interesting to hear about the start of someone's career. Thank you for that. The mission of the GAPNA Health Affairs Committee is to track and promote legislation and policies that enhance the advanced practice nurse and improve the quality care for our older adult patients. How long have you been involved with the Health Affairs Committee with GAPNA?
So formally with the Health Affairs Committee since 2015. So about 8 years, going on 9 years. I chaired the committee for a few years, 2016 to 2019. I was the chair of the committee. And it's interesting, when I was thinking back on this, health policy was not in my wheelhouse. It was not something I did. And I think we hear that a lot from nurses. And when I graduated with my DNP, we had to do a review of our alignment with the essentials to ensure that we had met the essentials. And frankly, I felt really good about most of them, except for the health policy one. I got it, but it wasn't my strongest area. And that's when I joined the Health Affairs Committee. And it was a great opportunity really to listen and learn and ask questions, because I don't think anyone comes into it as an expert. I think you listen to other people, you learn about the resources, you ask questions, and then ultimately was chairing the committee. And now I'm back as a member, but certainly have learned a lot and look forward to continuing to learn, and definitely the professional things that are out there, and then the behind the scenes things, what's going on with our Congress right now. It's just interesting and fun to learn from other people.
How did your geriatric experiences when you were at United Health Group frame some of your advocacy for policy changes that you wished you could impact, or ones that were active in changes?
Yes, well, geriatrics has been a passion of mine since college, and that I knew I was going to go back and be a GNP. So I'm an old-fashioned GNP. Older adults have always amazed me, and I think their histories and their stories are just fascinating. And when we think about what they've been through, and frankly, what we owe them as a country and how can we give back, long-term care was where I started my career. The workarounds in I couldn't sign the x-ray order, I couldn't sign the regulatory visits. I did the admission visit, and my colleague would come in and sign it and bill it. At first, I didn't get it. It didn't make any sense. But that's when I was, wait, what am I doing? What's the role of the nurse practitioner? And why can I not sign this piece of paper? Because I'm doing all the work. When it came to older adults, that came a little bit later. Within United, we were starting a community-based program. And I had come from long-term care. I had done home care as part of primary care, but really building out a community-based model under Medicaid. And it was a new experience, and understanding the funding of the home and community-based services. And how can we advocate for individuals to receive these services? There are no people to help them. They don't have large bank accounts that can fund this themselves. How are we going to be able to help them? So really that Older Americans Act and the funding that goes into all of the services to support our older adults, I think is critical.
And as an advanced practice nurse in that arena, you're perfectly suited to be in that position to advocate for the patients. When you look back at your time with the policy committee, have you had any premier projects or things that you'd like to share with us?
I think the Health Affairs Committee's done a lot of work in aligning with the strategic vision of GAPNA, really thinking about how do we educate and engage others. And so I'm sure you know that we do the one piece of the annual conference. We generally have a presentation every year at that. We were incredibly fortunate in 2018. The conference was in Washington, D.C., and we had a pre-conference on health policy, and it was something that we had never done. Rosemarie from the GAPNA office was incredibly helpful in helping us get the continuing ed credits at that time, but really had, I want to say 60 or so participants who came to learned about our priorities for older adults, and then had the opportunity to make visits on the Hill and come back and share them. And it was so rewarding in that when they came back, everyone was so surprised how little the legislators knew. So when we think about diabetic shoes, gone on forever, home health, we can take care of everything for a diabetic patient except order shoes. It just rattled their minds. And so we always think they must know more than we do. They don't. So really going in, it's unusual to have an advanced practice nurse as your legislator. So you can assume that you know more than they do, especially around the care of older adults. So we've done that. And last year it was fun because the ICANN Act came out. And I think it was Jenny Kim who developed a QR code. So we went out and handed everyone that QR code so they could immediately send the letter. Sometimes people think it's a big, complicated process. And I will say our partners at AANP have made it very easy, and they open up their voter voice code for us. So you open the code and you can click a few buttons and send the letter right off. And that is first step in, advocacy. And then last year, most recently, and then we're going to continue, we did create the Health Policy Toolkit.
Yeah, I'm so interested to find out some of the contents and how they can help the direct care advanced practice nurse in their advocacy journey.
Yeah, absolutely. So we, at the 2022 conference, we had a 1-hour presentation on health policy and advocacy, and it is incredibly difficult to get everything into 1 hour, but it can also be incredibly overwhelming at the same time for someone who's never done it. So a team from the Health Affairs Committee broke out that presentation into part one, an overview of what health policy is, an overview of what the priorities are for GAPNA, where we are focusing. Again, it's on nurse practitioners and older adults. Part two is all about the advocacy process. How does it work? And again, it's not complicated. It's not a big secret. It's all about building relationships and getting to know your legislators. And then step three, or part three, is really the nuts and bolts of what to do when you're meeting with a legislator, how to get ready, what you should do, what you shouldn't do, just some quick tips. But again, it's really about the relationships with your legislators.
That sounds so wonderful. I'm going to surely make that available to any of our local members that are not aware of that being on our website. So I want to ask you, and you mentioned a little bit about our current issues in the government and just the climate of disrest and, distrust and, that poor communication. Do you have one policy issue of our older adults that is coming up that is threatened in this culture? Something that really keeps you up at night?
One, there's lots of things that keep me
All
up.
right, several bad dreams. Okay.
Well, honestly, I think the biggest one is funding, funding, and how are we spending that money? And there's lots of money, there's a lot of priorities. In my mind, it is so important that we as nurses, nurse practitioners, caring for older adults, we need to help our legislators understand the importance of the funding and why we're asking for it. We're not asking for $50 million for, a theater to have whatever. We are asking for funding for the Older Americans Act that would support home and community-based services. And as we're thinking about more services going to the home versus in the hospital or subacute or long-term care, that's where baby boomers want to be. So how are we going to fund the care of those older adults? The care, long-term LTSS, long-term support and services, support for ADLs and IADLs. It sounds really easy. Let's have the family do it. What if there isn't family local? What if the family is an 89-year-old wife? How is she supposed to help, her husband, 93, 250 pounds, get dressed in the morning? So really helping our legislators understanding the realities. And I think we are starting to see many of the legislators have parents who are now facing these issues. Home care is very expensive. They can't get Meals on Wheels because their area isn't funded. Things like that. So I think examples that we can bring and share is really important if they don't already know them, and we can continue to share them.
So helping our legislators really put a face and tell a story about some of the social services that they seem to always be at the forefront of the chopping block when we're talking about budget cuts. So that's something that we could do. Was there anything else that really concerns you besides funding for our older adults?
Well, it's also linked to funding. Follow the money is nursing education. We need to be paying faculty. We need to be finding faculty. We need to be paying nurses a fair wage, certified nursing assistants a fair wage. We need to develop those partnerships and have funding to develop those academic practice partnerships so that we can have the preceptors and students really working in these settings. Straight up nursing education, really important. The content on geriatrics is even more important. We're seeing, I don't know if they're covering it in undergrad or they're brushing over it. I do know in nurse practitioner programs, I think geriatrics is not getting the time and attention it needs. And when we look at the population and the growth in the population and not having nurse practitioners to care for them in a high quality, cost-effective way is very concerning. So yeah, the baby boomers are going to be demanding better care from qualified, certified individuals. So it'll be interesting to see where things go. But funding.
And the education, I can see that is certainly a future investment. I mean, for all of us as we get older. When we look at the curriculum, it's often just relegated to a couple of slides at the end of a presentation, age-related changes.
Mm-hmm.
So, not even really understanding the physiology of aging. This has just been wonderful and great inspiration for advocacy. Do you have any parting thoughts or elevator speech related to health policy that you would like to share with our audience before we go?
So the parting words is I would encourage everyone to look up their legislator's email, both at the federal and at the state level. Send an email. Hi, I'm Sue Mullaney. I'm one of your constituents. I am a nurse. I care for older adults. I'm an expert in long-term care. I run a diabetes clinic. Whatever you do, I am here if you have any questions for me.
That's wonderful.
It's about relationships. Continue the conversation. When something comes up, good, bad, or indifferent, it doesn't have to be a specific bill. It could be something about a new nursing home or something happening in your town. Make sure your state folks know about what's happening. And you are an expert in the field because they will then reach out to you and you can then reach out asking them for their help. So introductions is going to be very important now and through 2024. And of course, if there are changes after the election, it'll be even more powerful.
What a wonderful idea. An introduction before the ask. So that is a great strategy. I would like to thank you so much, Dr. Mullaney, spending some time with us today, and hoping that everyone out here has gotten some good ideas to take back to their personal practice and their personal state and local agencies. So for now, I'd like to say goodbye until next time, and be safe, be good to yourself, and be good to others. Thank you.
Thank you so much. Have a good day.
GAPNA Chat is owned and produced by the Gerontological Advanced Practice Nurses Association. All rights reserved. No portion of this podcast may be used without written permission. If you are an advanced practice nurse caring for older adults and want to further your career, GAPNA encourages you to sit for the Gerontological Specialist Certified exam and earn your GSC credential. This expert certification distinguishes APRNs with the knowledge and experience to manage the complex health needs of older adults. Visit gerocert.org to learn more. Dr. Sue Mullaney is a healthcare consultant, gerontological nurse practitioner, and gerontological specialist for SeniorCare Executive Services in Needham Heights, Massachusetts. Dr. Cassandra Von Ness is the Nurses Improving Care for Healthsystem Elders Niche Coordinator, Geriatric Oncology at the Moffitt Cancer Center in Tampa, Florida. She is a member of the Gerontological Advanced Practice Nurses Association communication team and is a host of the GAPNA Chat podcast series. For archived episodes of GAPNA Chat and to learn more about the Gerontological Advanced Practice Nurses Association, visit gapna.org. You can also subscribe to GAPNA Chat everywhere podcasts are found.